Most cats look perfectly healthy as they lounge on a sunny windowsill, chirp at birds through the glass, or curl into a sleepy ball on your lap. Yet behind that calm exterior, a handful of stealthy diseases can lurk for months, sometimes years, before a guardian notices anything is wrong. By the time weight suddenly melts away, breathing turns labored, or gums appear pale, the illness may already be advanced and difficult to treat. Knowing what can threaten a cat's life, learning how each ailment spreads, and spotting subtle early warnings can buy the most precious gift of all: extra happy years together. Below are 10 of the deadliest feline diseases, explained in everyday language, along with straightforward steps every household can take to keep danger at bay. Feline leukemia virus tops the list because it is common, contagious, and devastating, if undetected. The virus hides in saliva, nasal secretions, and milk. It spreads during mutual grooming, shared food bowls, or from mother to kitten. Inside the body, it attacks white blood cell factories and bone marrow, leaving the defense system too weak to fight ordinary bacteria. A cat can look normal for many months, showing only soft stools or a lackluster coat, until chronic infections or lymphoma suddenly appear. A quick blood test at the veterinary clinic identifies carriers, and vaccination protects cats that roam outdoors or mingle with unknown companions. Keeping infected cats strictly indoors and stress-free allows many to enjoy good quality of life for years. Feline immunodeficiency virus behaves somewhat like HIV in people, gradually eroding immunity. It is carried primarily in bite wounds, so intact males that patrol the neighborhood face the greatest risk. Because the first test after a fight may be negative, repeat screening 6 months later is wise. FeLV-positive cats can live long, comfortable lives when kept indoors, fed excellent diets, and given prompt treatment for dental or skin infections. The crucial point is early diagnosis, which allows caretakers to modify lifestyle and prevent secondary illnesses before they strike. Feline infectious peritonitis, or FIP, is the most heartbreaking viral threat because a harmless coronavirus present in many cats must first mutate inside the individual to become lethal. FIP exists in 2 forms. The wet type fills the abdomen or chest with straw-colored fluid, compressing lungs and organs. The dry type forms inflammatory gunk in the brain, eyes, or intestines, producing vague fevers, wobbly gait, or seizures. No single test confirms FIP, so veterinarians rely on lab patterns, imaging, and the cat's history. Until recently, the outcome was almost always fatal, but new antiviral medications have saved some patients, yet only if the disease is caught early. Guardians should never ignore persistent low-grade fevers, pot-bellied swelling that is not fat, or unexplained neurologic signs. Far more preventable is feline panleukopenia, the dreaded parvovirus once called feline distemper. Kittens are the chief victims. The virus ravages bone marrow and intestinal cells, causing sudden vomiting, bloody diarrhea, and collapse. Because the organism can survive on bowls, bedding, or shoes for months, disinfection and vaccination are critical. The core FVRCP shot given to kittens at 8, 12, and 16 weeks, then boosted, almost eliminates risk. Guardians who skip boosters gamble with a disease that can wipe out an entire litter in days. Diabetes mellitus has surged as cats transitioned from prowling hunters to indoor grazers fed calorie-dense kibble. When insulin production falters, sugar remains trapped in the bloodstream, causing excessive thirst, giant clumps in the litter box, muscle wasting, and a greasy coat. Untreated diabetes progresses to ketoacidosis, a life-threatening metabolic crash. Caught early, many cats respond beautifully to a carbohydrate-restricted canned diet, modest weight loss, and carefully titrated insulin. Some even revert to normal glucose regulation if managed before the pancreas is irrevocably damaged. Heartworm disease is less famous in cats than in dogs, yet a single mosquito bite can lodge a worm in the pulmonary arteries. Whereas dogs harbor dozens of adult worms, cats often develop severe inflammation around just 1 or 2, producing coughing spells, wheezing, vomiting, or sudden death. Because no approved drug kills adult heartworms in cats, prevention is everything. Monthly topical or oral prophylaxis year-round is inexpensive insurance against a heartbreak that strikes without warning. Chronic kidney disease, the bane of senior cats, creeps forward as microscopic filters scar. Early clues are subtle. The water bowl empties faster, urine clumps grow larger, and a picky appetite develops. Because blood creatinine does not rise until 2/3 of kidney function is gone, annual wellness panels and even newer SDMA tests that detect loss sooner are lifesavers. Specialized renal diets, phosphorus binders, blood pressure medication, and subcutaneous fluids started while the cat still feels good can slow progression dramatically, turning months into years of comfortable life. Hyperthyroidism usually strikes cats older than 10. A benign tumor in the thyroid gland spews excess hormone, revving metabolism like a stuck accelerator. The cat may seem lively, yet loses weight despite devouring food and produces lakes of urine. Prolonged overstimulation thins heart muscle, elevates blood pressure, and risks retinal detachment. A simple blood test confirms the diagnosis. Daily methimazole medication, an iodine-restricted diet, surgical removal, or, most effective, radioactive iodine injection can restore normal hormone levels and protect organs. Dental disease rarely earns headlines, but inflamed gums and resorbing teeth release bacteria into the bloodstream with every bite. Those gay microbes lodge on heart valves and kidney tissue, accelerating failure. Cats hide oral pain. Clues include drooling, dropping kibble, turning the head sideways, or grooming less. Yearly professional cleanings, extraction of diseased teeth, and daily at-home brushing reduce systemic bacterial load and enhance overall longevity. Upper respiratory infections seem mundane compared with the killers above, yet persistent viral or bacterial congestion erodes appetite and hydration, particularly dangerous in kittens and elderly cats who can dehydrate in 24 hours. Prompt veterinary care with steam, appetite stimulants, and sometimes antibiotics turns sneezes away from pneumonia and life-threatening liver lipid accumulation. An additional menace originates not in microbes, but in bouquets. Lilies. Every part, leaf, pollen, vase water can cause irreversible kidney shutdown if ingested or if a cat grooms pollen from fur. Because treatment requires aggressive fluids within hours and even then may fail, prevention is absolute. No lilies in any home where a cat resides ever. With this rogues gallery unveiled, the protective steps become clear. Keep cats indoors or supervise porch time to slash exposure to viruses, parasites, predatory wildlife, toxins, and trauma. Test new rescues for FeLV and FIV before introductions. Follow vaccination protocols tailored to indoor lifestyle rather than a one-size-fits-all schedule. Administer monthly heartworm, flea, and tick preventives. Provide fresh running water fountains to encourage hydration, and feed high-moisture, meat-based diets that mirror a cat's carnivorous physiology. Schedule wellness exams at least annually, semi-annually, for seniors, so veterinarians can compare weight, mouth health, thyroid size, and lab trends over time. Brush teeth daily with feline enzymatic paste. The 30 seconds invested each night prevents years of organ damage. Maintain a calm, enriched environment because chronic stress suppresses immunity and triggers viral flare-ups. Equally vital is the guardian's attentive eye. Weigh the cat monthly on a baby or kitchen scale, logging results. Count resting breaths. More than 30 per minute regularly can indicate heart or lung trouble. Track litter box output and water bowl volume. A new unpleasant mouth odor, mats in the hindquarters, or sudden isolation in a closet are the whispers before a shout. Acting on these whispers, seeking veterinary advice immediately, turns potential catastrophe into a routine treatment far more often than chance alone. Modern medicine, diligent prevention, and informed observation can transform once fatal diagnoses into manageable conditions. Today, FeLV-positive cats routinely live beyond a decade. Diabetic cats achieve remission. Hyperthyroid cats are cured in a single outpatient visit. Even many kidney patients enjoy years of quality life with fluids and diet. The difference is knowledge applied before damage is irreversible. Life with cats is a tapestry woven of quiet, companionship, sudden playfulness, and the soothing rumble of purrs. By learning the silent threats and acting decisively, guardians safeguard those moments. The reward is measured in soft headbutts that greet the morning, confident leaps that still span the couch in old age, and eyes that gleam with trust because their person listened when their body first whispered. Vigilance today means a healthier, happier tomorrow for both cat and human who share the journey.